Hi, I'm Helen Hall and I work at the James Paget in the R&D department as a grants advisor. And I'm really pleased to talk to you today about the Research, Evaluation and Quality Improvement Scholarships. So our scholarships were, the scholarship programme was piloted last year, and it was set up really to test the theory that if we gave individuals protected time and support to carry out research, evaluation, quality improvement and implementation projects, we would increase the capacity and capability and confidence of our workforce. And we would encourage them to continue to undertake such projects following the scholarship, which would ultimately lead to better patient care and outcomes. So our scholarship facilitation team included Professor Jonathan Webster from the UEA, our James Paget lead nurse for nursing, midwifery and AHP research, Claire Whitehouse, and a head of quality improvement, John T. Yazbek. This gave us a broad mix of skills within our team and lots of different expertise in different areas. We advertised the scholarship places in February and March last year, and the application process was competitive. We expected each potential scholar to have an outline of a project of interest to their area of work, which they had discussed with their line manager and team. The project did not have to be fully fleshed out or framed. This would be done during the scholarship programme with input from patients or other staff members or members of the public. We offered scholarships to 9 scholars from 3 different organisations. We had scholars who were a mixture of nurses, allied health professionals, we had a maternity support worker, we also had some non-clinical individuals as well, such as our Armed Forces advocate, we had a data management officer from the ICB, and a nurse from the aftercare service for the East Anglian Air Ambulance charity. The scholarship programme consisted of a protected day a week to design and undertake the project. Each scholar was assigned an external mentor, an external as in outside of the scholar's department or organisation. The mentor signed up to provide a collaborative mentorship experience, which included at least 1 hour a month, one-to-one with their scholar. We had some really outstanding mentors agree to be part of this project. For example, we had Professor Anne Lloyd-Keane, who was Deputy Health Minister for the Labour government, Kelly Beer, who was a clinical research nurse manager from Murdoch University, and we had Karen Watts, who's an Associate Director of Nursing for Norfolk and Waveney ICB. And we also had, and were well supported by our own Director and Deputy Director of Nursing. These intentionally external mentors increased learning and opportunities for both the mentor and the mentee. There were also mandatory taught module days provided as part of the programme, and these were provided once a month and included a mixture of research and evaluation specific taught and self-guided learning activities. For example, our library manager delivered a session around literature searching, and our information governance manager gave a really interesting session around GDPR and use of the data protection impact assessment. And that actually proved to be really important and useful because most of our scholars needed to use it for their projects. We have a running thread of sustainability throughout our programme, and we provided a session on the Greener NHS initiative, and we linked our scholars to the Oxford Centre for Sustainable Healthcare. We encouraged our scholars to consider the triple bottom line, that is social, environmental and financial impact of their projects. Running concurrently with the scholarships, we evaluated the programme using a realist approach, and we're just analysing the data from that now. So to give you an example of the types of projects undertaken, here are some of the examples. So we have Rachel, our maternity support worker, and she has been working on a baby loss awareness project. And she has had some really huge impact, providing support and resources for not just only families who are impacted by baby loss, but also staff members who provide care and support at this difficult time. Sarah Small, who's an occupational therapist, has been scoping a self-management pathway for people with inflammatory arthritis. She has linked with the National Rheumatoid Arthritis Charity and has been fortunate to have David Scott, one of James Paget's non-executive directors, as her mentor. And then we also have Kate Nichols, who is an ADHD nurse. And she has been working with children and families with ADHD and learning disabilities and autism. And this particular project explored the environmental impact of this service provided, and it was able to make changes to the service with a lot of input from the families involved. So we have had some absolutely amazing feedback from our scholars around the impact that being part of the programme has had on them. With our evaluation, we have been able to provide examples of increased confidence in the workplace and show how scholars have been influencing their peers to think more critically about the status quo. Some of our scholars have also applied for external research fellowships or applied for more senior roles. We've supported our scholars to present about their projects at regional conferences, and it's been wonderful to see their confidence increase. And now we have been really fortunate to receive some funding this year from Niche. This has allowed us to expand the scholarship programme across the whole of the Norfolk and Waveney ICS geography. We're hoping to attract applications from a wider range of health and social care organisations, and this will give our scholars a richer experience and lead to improvements tailored to the need of our whole population. So we have just launched our 2023-24 programme last week, and we are open to registered health professionals as well as non-clinical colleagues. So if you happen to know anyone who may be interested, please do spread the word. So thank you so much for listening to me today. And if you'd like to find out more or learn how to apply, then please do get in touch at this email address. Thank you very much.